The diet that reverses type 2 diabetes. Type 2 diabetic patients were told it's irreversible. You have to get on the medication. All we can do is manage it. Research isn't there. We have to wait until we have some cure. Unfortunately, the system that we have now is mainly looking at drug cures, not behavioral or diet change cures. There are 3 credible trials that showed that you can reverse diabetes. Okay, the first one was called the direct trial. 46% of people went into remission. Now, I know the word remission sounds like it's not fixing the problem because you have to maintain that lifestyle change, but all they really did is change their diet to a healthier version of what they were eating. The Montreal study showed a 40% reversal in type 2 diabetes, and then the Retune trial showed a 70% remission. That means you phased out of type 2 diabetes and you no longer have to keep taking the medication over and over and over and being at the mercy of whatever side effects they create. There was something very interesting in these studies. There were quite a few people who did not have a weight problem, yet they had type 2 diabetes. So you can't always correlate obesity or being overweight with diabetes. There are people that are thin that still get type 2 diabetes, primarily because some of the skinny people don't really show fat on the outside. They show it deep inside, around their liver, around their pancreas, around their organs, and you can't really see it by looking at them. So there's 2 things I want to go through. I am going to show you what to eat to reverse diabetes, but I first need to show you the phases that someone goes through before they get diabetes. Over a period of 10 to 20 to 30 years, you have normal blood sugar. And then one day, you're diagnosed with type 2 diabetes. And one way they diagnose it is a fasting blood sugar level of 126 or more. Prediabetes is between 100 and 125. Now, if you look at this chart, what jumps out? You're diagnosed way down here. Okay, at the later stages. This is where medicine intervenes. This is where you have a drug intervention way down here. If we look at this in reverse, what happens right before prediabetes is we have some type of tissue damage. And then before that, we have some type of maladaptation. So the body's no longer adapting. And then we get this stage right here where your body is adapting. Adapting to what? The root cause. What is the root cause? Excessive refined carbohydrates and sugar, fructose, especially if you're drinking high fructose corn syrup, and frequent eating. So as fast as you can actually consume this sugar, insulin comes in as a cleaning crew and pulls the sugar out. Why? Because glucose or sugar is very toxic to your cells. After this happens for a period of time, your body then is going to adapt and start to resist the receptor for insulin. If you resist insulin, it prevents glucose from going in the cell. And if it goes on too long, what happens to all this glucose? It gets converted into fat in your muscle and your liver. So now we have the different body tissues that are acting as a backup space to deal with all this excess glucose. Now, what's interesting at this point is you still have normal blood glucose. Why? Because your body is making a tremendous amount of insulin to compensate and really have a primary goal of keeping the blood glucose normal. Okay, so then we go another decade of time, and now some of this fat has invaded the pancreas. Okay, now this is where the insulin is created right here. So now we're getting tissue damage. Now we're getting more inflammation. Now the cells that make insulin, they're called the beta cells, they're getting exhausted. So they start to go downhill. And so now the insulin's to the point where it can't keep up anymore with all that carbohydrate that you're consuming. So what's going to happen, it's going to start filling up in your arteries. Okay, so now the blood sugar level is going to go up. But look at how long it took to get to this point right here. This is where we have pre-diabetes. Your blood sugar is like 100, maybe 120, and then up to 125 right before you go into diabetes right here. Now, in this stage right here, tissue damage, it's basically maladaptation with time. So we're going to get glycation, which means that the sugar is going to get stuck to the protein and it clogs everything up and it makes that protein no longer available to you. And if that happens in the arteries, your arteries get stiff. So guess what happens to the blood pressure? It starts to go up. Then we become a pre-diabetic, and then we go right into being a diabetic at 126 or more blood glucose. If you take all of the blood in your body, it roughly comes out to maybe 1.5 gallons. Normal blood glucose is about 1 teaspoon of sugar, okay, for all of your blood. Well, guess what diabetes is? That's 2 teaspoons of sugar. It's not a lot, but that makes you a diabetic. But think about how much sugar an average person consumes. And I'm talking about all the things that convert into sugar too, like starches, refined carbohydrates and grains, pasta, cereal, all that stuff. They're consuming a lot more than 2 teaspoons of sugar, sometimes up to 50 to 100 teaspoons of sugar a day. And as that blood glucose starts going higher and higher and higher, it's very, very dangerous. Now, what happens after you're diagnosed with diabetes is there's 4 main tissues that are targeted that tend to get damaged. The kidneys, your arteries, the nerves, also the eyes. Unfortunately, medicine focuses over here. They don't go into this area right here. They probably don't have time because the average time is like 7 to 10 minutes in an office visit. And also they're not trained in lifestyle factors right here. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information. Now let's get into how to reverse diabetes just with your diet alone. I've already mentioned 3 major trials. The direct trial that produced 46% remission. The Montreal trial, 40% remission. And the Retune trial, 70% remission. These results were better than a lot of the drug results. And on top of that, there's virtually no side effects when you change this using diet. Now, unfortunately, a lot of doctors still don't know about these studies because there's no money in using diet to actually fix or cure a medical disease. There's not going to be a lot of promotion on this by Big Pharma. But you personally need to know about this. So when you go into the doctor, make them aware of these studies and suggest that you want to start to use your diet to improve your diabetes. The research is there, and hopefully they'll work with you to make some adjustments and slowly wean you off the medication. If your environment is off, everything else struggles. It's like a fish tank. Pollute the water and the fish get sick. You could feed them the best food, you can treat every single symptom, but if the water stays toxic, nothing recovers. The body runs on 10 signals like insulin, cortisol, inflammation, sleep quality, gut function. Every one of them affects how you feel. But there is always one signal that is more broken than the rest. And until you fix that one, everything else stays stuck. I built a free 2-minute quiz that finds it for you. It tells you which one of the main signals is holding your body back right now. Click the link in the description, take the quiz, and stop guessing. Very simply, I'm going to show you what to eat, okay? It's going to be a combination of 2 things, but there's something else that you need to know. Frequent eating, aka snacking, also will start to spike that blood glucose, regardless of what you eat, because our bodies were never designed to eat that frequently. So to really take this to the next level, what we want to do is combine 2 things: the lowering of the carbohydrates with the infrequent eating, or it's called intermittent fasting. In the morning, you can have your coffee if you want it with cream, just don't add sugar, but don't eat any breakfast. If you're hungry, go ahead and eat, that's fine, but maybe have a goal within the next week that you're going to only eat when you're hungry, because if you do what I'm going to show you, your hunger and cravings are going to go away very, very quickly, and it's going to make it easy to wake up in the morning and go longer without having to eat food. One of the best ways to know if you have blood sugar problems or you're headed towards this prediabetes is your inability to go from one meal to the next without needing food. If your system is healthier, you can go a longer period of time without eating. I had a serious problem with blood glucose. In fact, in my first book, I told people the most important meal of the day is breakfast. Now, I no longer recommend that, and I did upgrade my book. But when someone first told me about intermittent fasting, I kind of laughed at them. I didn't think there was anything to it, but it was the thing that I needed personally to turn things around, because our bodies were not designed to graze all day long. Our bodies will start healing when we give them a chance to rest. So in the morning, okay, ideally, you can have your coffee and cream, but just don't eat anything. Go all the way up into lunch and have your lunch as your first meal. Now, if you're used to eggs and bacon, fine, make that your first meal. But what you want to eat in this first meal is animal protein. For those people that are a vegan, maybe it's against their religion to have animal protein and they just can't do it, there are other videos where I show you what to eat to be able to come close to that. It's more difficult. I will put a link down below for those individuals that can't do this. As far as when I talk about animal protein, I'm talking about any type of meat, fish, eggs. I'm not talking about protein powder. Now, there's other things you can eat too. Cheese, yogurt, kefir is another thing you can consume. You can have some nuts as well and seeds. That's not a problem. You can have any of the vegetables that you want. I consume a lot of fermented vegetables, sauerkraut, pickles, kimchi, but you don't have to. You can just have a salad or even an avocado or tomatoes. Now, can you have fruit? At this stage, I only recommend you do berries and not more than a cup per day. We're trying to get our carbohydrates below 50 or even better, below 30 grams per day. Now, can you have different fats? Absolutely. Butter, olive oil, tallow, lard, avocado oil. So that's what you're going to eat in meal one. Keep it simple. And then guess what? Meal two is pretty much the same thing. And no snacks. And then your second meal, animal protein, veggies, yogurt with pecans, maybe berries, something like that. And then here's the thing that you need to do. You need to get a little sign that says kitchen closed, put it on the fridge. So this is what you're going to eat. Keep it simple. And this is what you're going to avoid. The sugar, starch, fruit, beans, juice, grains, and seed oils, the corn oil, the canola, maltodextrin. Now, step two, and this is really important, is we need to get the junk out of the trunk by eliminating all the snack foods in your pantry and in your refrigerator. The next time you're hungry, tired, or stressed, you're going to go to that. So we don't want to have it even available, and make it a personal rule that the next time you go shopping, you work off of a list and you don't buy anything off that list. I also recommend, if you can do this, to go for a walk after your meals, maybe a 10-minute walk. That is going to speed things up because you're going to burn off any little bit of sugar in your body. A couple other things that will make things more smooth is magnesium glycinate. Magnesium is necessary for blood sugar. It's necessary to help regulate insulin levels. It's necessary to help you sleep. And I take this in the evening. I recommend getting a powder. And then also find a high potassium electrolyte powder, because potassium is another thing that a lot of people are missing. And potassium will help with electrolytes, because when you do this, you're going to dump a lot of extra fluid retention that you've been holding. Sometimes 7 to 10 pounds in the first week. And with all that water loss, you're going to lose electrolytes. And so one of the most important things to do is to put the electrolytes back, potassium, magnesium, and don't restrict sea salt. You want more sea salt. If you have any muscle cramps or muscle weakness when you do this, add more sea salt, potassium, and magnesium, and you're going to do fine. The next thing to know about is all the nitty-gritty details, okay, about how to do this. And for that information, watch this video right here. Check it out.